Hi everyone, I'm Paula. I am in my last month of residency here at Wills, and I got the opportunity to go to Guatemala for my wire trip. So I spent 10 days in Guatemala with a group of US and UK-based volunteers, and the goal of the trip was to screen and treat 150 patients who were already identified by local medical providers of needing specialized eye care, who otherwise couldn't afford or access it. I was connected with this group through Dr. Finkley and Dr. Anhalt from the Wills Eye Academic Global Ophthalmology Program. They had heard from Dr. Myers from Northwestern that there was a group from Loyola that was going to Guatemala for a surgical and skills transfer mission trip to Guatemala, and they were looking for some more hands. So that's how I got connected. It was last minute and it worked out beautifully. Leading up to the trip, it was largely funded by Humanity First USA, which is a nonprofit organization working in human development and disaster relief. And it was originally scheduled for October, but due to political unrest, it was rescheduled to April of this year. In the months leading up to the trip, we had Monday night Zoom meetings that were always scheduled for an hour and would go for way longer than that. And at that time, we'd talk about what equipment we might need and how we were going to get it. We were planning to do phaco, M6, and also pterygia, as well as just trying to see as many complex patients as we could while we were down there. So this is just one of the minutes that we had from one of our Zoom meetings. And this is our consolidated supplies list. So the amount of work that goes into planning a successful trip still just blows my mind. On and on and on. So a lot more goes into one phaco. All right, so our team included non-medical volunteers, pre-med students, medical students, residents, attendings, OR nurses, and a lot of really wonderful Nasser Hospital staff, and I'll talk about that. So most of our time was spent at Nasser Hospital, which is located in the Zacatepeques area of Guatemala. It's about 1 hour from Guatemala City by car, and then 30 minutes from Antigua, Guatemala, another well-known city. The hospital opened in 2018 with the goal to provide equitable health care to individuals from all socioeconomic backgrounds in that area and also the surrounding area. We had multiple patients from surrounding countries as well. So it's been 2 months since the trip, and my co-residents can attest that I have not stopped talking about it. As I had mentioned, the initial screening was done by optometrists and other local medical providers, non-ophthalmologists, in the several months leading up to arrival. And if flagged by those providers, the patients were then asked to come in for our screening clinics. And although most patients were sent for advanced cataracts and pterygia, we saw everything. Post-trauma, notably months or years or decades post-trauma. We saw advanced retinal disease, malignant conjunctival tumors, infectious keratitis, a whole bunch of neuro-ophthalmology. It keeps following us everywhere, and severe glaucoma. This is my shout out to the Wills Eye ER. Nothing scares me, so I feel comfortable that I've gotten great training here at Wills. If the patient was determined to be a surgical candidate, they would get preoperative testing and be signed up for surgery either later that day or the following day. And so we had an OR schedule running. So after spending the first day setting up the clinic and OR space, and that first day was 7 a.m. to 10 p.m., the OR was up and running all day, starting the following day from 8 a.m. to 8 p.m. We usually would operate on 2 patients at a time in the main operating room, which we borrowed from the general surgeons, and then we set up a pterygium station in the hallway, essentially. We would do about 20 cataracts a day and 5 or so pterygia cases a day, and none of the cataracts were routine. I do want to shout out to my husband, Patrick. He's at the top of this slide here, fixing the microscope with Dr. Bouchard. He was able to join me for the trip. He is non-medical. He's a software engineer, and we had such an amazing experience going through this together. He did it all. He built a microscope. He rebuilt a microscope. He transported patients. He did all the lens calculations. He knows so much more about my job than he did before we went on this trip. And I think the only person who enjoyed it more than me was him. So I know he's watching this stream, and we're already talking about our next trip together. We learned a lot, had a little bit of fun too towards the end of the trip. We had an academic evening scheduled for our last clinical day. That was planned by me and by Munaza, who was a resident joining us from the UK. I'm obsessed with her. She's such an awesome person. But it was basically an evening of lectures that were accessible to non-ophtho medical providers and residents that joined us from Guatemala City. And then we ended it with a fun Jeopardy game. Tried to include everybody in that way. So what I want to talk most about was the why, and why I think every single Wills resident should take advantage of this opportunity. The point of a trip like this for me was to provide excellent care to patients who otherwise would not get it. And I know Sarah had mentioned these stories. I'm going to tell you a story about one patient, not the gentleman pictured here, but it was a woman who was a seamstress her whole life, and at around age 50, she started getting horrible bilateral cataracts. It left her bedbound, so she was no longer able to provide income for her family, which meant that her other family members, including her own mother, who was older than her, had to go out and get a job. And she was living in a new space that she just could not get around. So she was bedbound for 12 hours a day until her family members came home from their respective jobs. And even cataract surgery on one eye gave her some independence, or a lot of independence really, to a point where she's actually back to work. And you hear stories like that day in, day out, and they have the same unbelievable impact on you. I don't think it could ever get old. So providing good care to those who need it. And like Dr. Finkley mentioned and others have mentioned, education, in particular educating local providers and local trainees. And it doesn't just have to be ophthalmologists. We went through the differential of a red eye with some of the ED docs, and not everything is angle closure glaucoma, but if it is, this is what you do. So you're not going to be teaching everyone cataract surgery or other ophtho surgeries, but there's so many other ways to help. The optometrist, William, who spoke no English, and my medical Spanish is bad at best, we would communicate through pantomime all day, showing each other things at the slit lamp, and it was just really unbelievable that even as a resident, I was able to be a part of that knowledge transfer. Of course, the other pro of getting involved in something like this as a resident is networking and collaboration. You're meeting incredibly passionate and incredible people, and it makes you a better surgeon. The goal of the trip was not necessarily for residents to do surgery, although we did get to do some of that. We ran the clinic, the three of us, and we're very proud of it. But by having to do surgery with equipment you're not used to, and seeing how other people can do an M6 case way faster than, no offense, Wills attendings, any of you can do a phaco, you see that there is more than what you've been exposed to, and it forces you to be better. The fact that none of the cases were routine, coming back here to a nice OR day with Dr. Markovitz felt like a breeze. So makes you feel more confident as a surgeon as well. And then, of course, fulfillment, the feeling of fulfillment and the impact that you have. As a resident, by this point in training, we are burnt out. I think this is the perfect burnout cure. So I'm just really, really thankful for the opportunity. So a couple of things. I was looking through my phone. This is a really, really corny screenshot. I was writing this on the flight back from the Guatemala trip. And then this is actually a screenshot from our group chat. Dr. Cahook mentioned that he has all his WhatsApps that are very active. Ours is active as well. We're talking about the next time we're going to be going out there, hopefully early next year. I'm going to University of Michigan, Kellogg for a cornea fellowship, hoping to get involved with their robust global ophthalmology program while I'm up there, and can guarantee that this is something I'll continue to make a part of my career going forward. I'd like to thank Gift of Sight and the Nasser Hospital team, the Wills Eye Global Ophthalmology Department, Dr. Finkley, Dr. Anhalt, the Wills Eye Foundation Alumni Society, and of course the Wills Eye Hospital leadership, Dr. Haller, Mr. Bilson. Making this an accessible opportunity has changed my life. So thank you very much.